How can I find the right home care provider for my elderly loved one? Identifying your elderly loved one's specific care needs involves determining what assistance and support they need to live comfortably. Medical, emotional, and daily task support are examples. A UN report projects 1.5 billion people over 65 by 2050. This means more people will need to identify their elderly loved one's care needs to ensure they get the right care and support. To identify these needs, talk to your loved one about their abilities, limitations, and health conditions. A doctor or geriatric care manager can also help. Identifying their care needs can help your elderly loved one maintain independence and quality of life. To ensure your loved one receives quality care, check the credentials and qualifications of elderly home care providers. Methods for assessing providers: examine their credentials. State and local governments license home health care providers. Request their licenses and certificates for verification. Request references. Request provider references and follow up to learn about their experiences. Background check. Check the provider's background for criminal activity and abuse or neglect. Assess their expertise. Ask about the provider's elderly client experience and training. Find elder care specialists. Consider their communication skills. You and your loved one need a provider who can communicate well. Interview their communication skills. Check their suitability. Ask providers if they can meet your loved one's needs. Find flexible providers. Follow these steps to find a reliable home care provider for your loved one. Researching and advising the elderly requires systematic surveys and investigations to understand their needs. The elderly population is growing and has unique healthcare needs. By 2050, the world's 60-plus population will nearly double from 12% to 22%, according to the WHO. Studies show that the elderly are more susceptible to chronic illnesses and disabilities that require special care. Researchers collect elderly recommendations through surveys, interviews, focus groups, and observation. These methods help researchers understand elderly challenges and find the best ways to improve their quality of life. High blood pressure, arthritis, heart disease, and cancer were the most common health issues for older adults in a U.S. study. The study found that most seniors want to live alone but need help. The study suggests implementing home-based care programs, providing affordable healthcare, and creating age-friendly, safe environments for seniors. Communicate with the elderly caretaker and set expectations. Good communication reduces misunderstandings and improves care. An AARP survey found 44 million Americans unpaidly care for elderly relatives. Only 42% said they had caregiving expectations. This may confuse and frustrate the carer and elderly person. To avoid this, discuss the caregiver's duties, schedule, and expectations. Transportation, medication, meal planning, and communication are examples. Discussing the elderly person's needs and preferences is crucial. Setting clear expectations and communicating with the carer can help the elderly person receive the best care and support. It is critical to monitor the quality of care provided to elderly people and address any concerns or issues that arise in order to ensure their well-being and safety. There are several approaches to this, including checking in with the elderly person or their carer on a regular basis can help identify any issues or concerns early on. Phone calls, video chats, and in-person visits can all be used to accomplish this. Surveys and feedback forms can be used to collect feedback about the quality of care provided from the elderly, their family members, or carers. This feedback can be used to make improvements and address any issues that have been raised. Quality audits can be performed to ensure that the care provided meets certain standards. This can include ensuring that medications are properly administered, the environment is safe and clean, and the elderly person's needs are met. The cost of in-home care services will vary according to the level of care required. Companionship care, which includes light housekeeping and errands, will, for example, be less expensive than skilled nursing care. There are several options for covering the cost of home care services. Private pay, Medicaid, Medicare, long-term care insurance, and Veterans Affairs, VA, benefits are examples of these. It is critical to investigate and comprehend the eligibility criteria and requirements for each payment option. After determining the type of care required and researching payment options, it is critical to make a budget to ensure you can afford the cost of home care services. Take into account the cost of services as well as any additional costs such as equipment or supplies.